Okay, for our second scenario, so this is a 2-day-old baby born at 37 weeks by vaginal delivery. Mom began MAT during the last month of this pregnancy, has been in an MAT program before, is also on Zoloft for anxiety. This is her second baby. She has a 2-year-old at home who's staying with her mom, has had to leave for a few hours each day to see her daughter, and the last assessment was 3 hours ago.
Come in. Hi, Ms. Johnson. I'm Ann. I'm going to be the nurse taking care of you and your baby today.
Hi, nice to meet you.
Nice to meet you. How are you feeling?
Okay.
Okay,
Just
good.
tired.
Yeah, it's tough, right? How's the baby?
She's doing okay.
Does she have a name yet? I'm sorry to interrupt you.
Jane.
Jane. Go ahead. Tell me how she's doing.
She's doing okay. I'm really trying to breastfeed. I didn't with my 2-year-old, so I'm really trying hard this time. But we're really struggling. She's having a really hard time latching.
Okay.
She gets really frustrated, and so she doesn't latch very long. I think with one feeding, I've been trying to write it down. She was able to feed for 10 minutes, but that's about the longest.
Okay. And are you hearing her swallow when she is feeding?
Sometimes,
Okay.
and then I think she just gets really frustrated,
Yep.
and I get frustrated,
Yeah.
so it doesn't go well.
Yeah. And what kind of cues is she giving you? How do you know she's hungry? When are you deciding to feed her?
Well, the nurses have been coming in to remind me too, but when she is kind of fussy, which seems to be frequently, but the nurses have told me to try to feed her every couple hours, but she seems to want to eat more than that.
Okay.
But then she doesn't latch for very long.
Okay. Tell me a little bit more about the fussiness.
Every time I put her, well, I've been trying to hold her a lot. That seems to help. I can't be here all the time. I have a 2-year-old, and my mom's with my 2-year-old. So I feel really guilty about that. So when I'm here, I hold her, and then I put her down, and she startles and wakes up right away.
Okay. Okay. So when you say you put her down and she startles, is that every time or is it?
Almost every time.
Okay.
She doesn't sleep for very long, maybe at the most an hour.
Does she sleep when she's being held?
She does sleep longer if I'm holding her, but I can't be here all the time.
Yeah. Okay. So I think we should have a full care team huddle.
Okay.
So I'm going to go, give me a little bit of time. I'm going to track down the doctor, and then we'll come back in and kind of tease out some of these issues and see if we can come up with some things to help.
Okay.
Hello, doctor.
What's going on?
So we have Miss Johnson and her baby girl Jane
Okay.
in room 312. She's 2 days old. She was also,
This is the NAS baby?
This is the NAS baby.
Okay.
Mom was also on Zoloft, of course.
Okay.
So the baby's super fussy. She can't get her to console. She also has a 2-year-old at home. Hard to, just tricky. She says the baby sleeps okay when she's holding the baby, for an hour maybe. But when she has to put the baby down, the baby cries. So she's also having trouble getting the baby to latch. Sounds like things are a little tenuous in there.
Okay. Well, why don't we go see? But give me about, I got to go activate that baby, maybe 5 minutes, you think?
Yeah, this isn't urgent.
Okay. All right. Well, let's go take a look.
Come in.
Hi. Oh, hi. You're here today.
Hi. Yeah.
I didn't see you all day yesterday.
Oh, yeah. I
What's
have
going
the
on?
other baby at home.
Oh, okay. How's the other baby?
She's doing okay. She's 2, so it's hard on her and it's hard on me.
Okay. Baby's not doing well again today?
I mean, she's doing okay. I was telling the nurse that I'm having a hard time feeding. She's not latching well. She did have one feed that was 10 minutes, but that's been the best.
And how are you feeding your baby?
I am breastfeeding. I'm trying to exclusively breastfeed with this baby.
Wait, are you, remind me again, are you in a recovery program?
Yes.
Okay. Have you been getting drug screens done?
No, I was screened during my pregnancy.
Okay. Now, did you have experience with another NAS baby with your 2-year-old?
No.
Okay. All right. And so, keep going.
Well, I was telling the nurse that she's having a really hard time settling. She's just crying all the time, and when I hold her, she is comforted, and then I put her down, and she startles and wakes up right away and is just screaming. I don't know how I'm going to take her home.
Oh, okay. Tell me a little bit more about sleeping.
I think I've been trying to journal, and I think the longest she has slept is about an hour.
Okay.
Not in my arms.
Okay.
If I'm holding her, I think she'll sleep longer. But I can't be here all the time.
Okay. And the reason you can't be here all the time?
I have a 2-year-old at home.
That's
and,
right.
Yeah, my mom's doing her best, but she works.
Okay, your mom? Mm-hmm. Okay, and she works at...
She's been able to take some time off to help me out.
Is she also taking care of your 2-year-old as well? Now, is there even a partner around?
No, not a lot.
Okay, all right, that's all right. We, how about, so you said you hold the baby can sleep. But if you're not holding the baby, then the baby is usually fussy and irritable. Okay. And then eating-wise, we're having some trouble there. And how long do you have to hold the baby or console the baby before the baby quiets down?
Oh, it seems like forever. I mean, maybe 15 minutes or so it takes her to calm down.
Okay. Okay. Sounds like the baby is suffering a lot.
Oh.
What do you think?
Sure does.
Do you think we need to go to drugs?
Well, doctor, I feel like there are a few things that we could do before we went to drugs.
That's right, the new protocol.
Yeah, so why don't we go down the checklist and see what we could increase, perhaps a review.
All right. Okay, well, let's go over the protocol.
So in terms of opportunities to increase our Eat, Sleep, Console care, we could improve our rooming and presence. It sounds like it's difficult for Ms. Johnson to be here all the time with her 2-year-old, and then her mother is working. But perhaps I can look into our cuddler program and see if we can get some cuddlers that are reliable and able to come in, and I can explain more to you what that is in a bit. And then that kind of covers parent-caregiver experience or presence. Are you getting some good sleep and rest and able to take care of yourself as well?
As much as I can between pumping at home when I'm not here and then a 2-year-old. Sleep's been hard.
Okay. So we're, I think with optimizing our cuddler program and trying to help you take care of yourself, we're gonna help you minimize, decrease your stress and help make your time here with Jane a little more, a little easier and less stressful. Okay. So then, I know we have her in this pretty bright room near the nurses' station. Perhaps we can look into moving her to a quieter area of the unit.
That sounds great.
I'll look into that. I'll talk to Charge later. And then I want to review some of the areas of our care, like swaddling Jane and using a pacifier. Is she using a pacifier?
Yes, I've tried that.
Okay. Does she seem to like it or no?
It seems to work for a little bit.
Okay. So I'll come back once we sort of check down a few of these things and sort of re-show you how to swaddle. I'm sure you've seen it before. I'm sure you're an expert with your 2-year-old.
No, the nurses do it so much better than I can.
Well.
You don't worry about it. We'll take good care of your baby.
Yeah. And we'll start there. I think we also need to get you a lactation consultant, okay?
Okay.
So let's work together, figure out a good time for you to be here that you're able to meet with the consultant, and then I'll get the consultant to you.
Okay.
Okay?
All right, does that sound good to you?
That sounds like a good plan.
Okay. All right.
Thanks.